So you just rotate in different directions. It's more for joint mobility. So you just take like this and relax. The client has to relax. So you're just taking and moving the arm through range of motion. It's rotating the shoulder joint. Like when we do stretching, so you will end up stretching like this, pulling back, but when we rotate, there's not always a stretch involved. So you're just taking the shoulder through a range of motion. Passive. The other thing we can do with rotating here, which I like to do, I use this quite a bit, is work into lung 1 or lung 2. Just take fingers, apply pressure downward, okay? And then I'm rotating around the joint as I work in the acupressure point. You could do the same working to like LI15 if you wanted to. You can be a little tender. I'm backing up my pressure. Okay, so here we rotate for the shoulder joint like this, but this is where we can hold acupressure point. So your two options here, just taking the arm through circumduction, go either direction, this. And then when we do stretching, then we can start to incorporate stretches into the range of motion, like so. Okay, but we're focused on rotating today. The next is rotating the elbow. So rotating the elbow looks like this, but we'll do the same thing we did when we worked on the knee in the prone position, where you're going to grasp around the tendons, or you can work like in heart 3 as you rotate inward, or if you rotate outward, you can work in LI11 around the joint. You could work into lung 5, any of the acupressure points. Usually if I rotate, I'm just typically grasping the tendons and kind of do a grasp and release. This is rotating for the elbow. And then next we have rotating the wrist. I'm going to rotate the wrist. You'll interlace your hand with the client. Remember we did stretching before? So now we can rotate. Just make sure you follow the articulation and don't bring it beyond the articulation of the wrist. You don't want to push it too far. Rotating. This is all just good stuff for joint mobility. That's rotating the wrist. Then next, we'll do rotating the hip. So when we rotate the hip, you're going to take the leg like so and just take it through a range. You can point the leg in certain directions. Just again, go with the range of motion. If you feel restriction, that can clue you on where a person might be tight, where you go back and do massage work on the musculature. Especially, I think you guys are doing kinesiology now. So it tells you, kind of what muscles, are going to do what. I would say if someone's extremely tight in the hip, sometimes the tendon of rectus femoris can pop over the anterior superior iliac crest, so just be aware of that. That can cause some discomfort, but that's very rare that people have that. So that's rotating. And then last, in this position, again, we can rotate the ankle. So for the ankle, we had shaking, right? We have rub rolling for the foot, and now just rotating. So you grasp at the ankle, so you push upward a little, and then you can work into acupressure points here if you want as well. So we rotated the ankle in the prone position as well. Okay, and then last, we'll have you sideline. So I'll have you lay on your side facing this way. And this would, I would do this if I'm going to use this more like after the massage. You don't do this with draping. You can use some of this stuff with a sports massage. As far as people running, biking, that sort of thing, pre or post event. So here, this is rotating the hip. What you're going to do is you're going to grasp around the knee like so. You just place one hand on the low back like this, and just a different range of motion. When we do stretching, what we do is we incorporate a stretch. See where you press on the low back as you pull the leg back towards you. And this is done with torque at your waist. So for today we'll do, rotating. And then when you end up doing stretching, then we add some stretch in with some of these rotations. So that's rotation in the supine position. So